Well, time check is 10 a.m. We are here at Semuto Health Center 3. But the challenge here that we are finding here is that there are no medical workers in the hospital. The patients have already arrived expecting attention from medical workers, but none of the health workers here have showed up for work. But what you should not forget, there are always very many challenges. But speaking to residents here, they have narrated to us the problem that they are going through with having health workers living at the hospital, and they are not giving them enough attention.
Ensonga esooka omusawo bw'abanga azaalibwa ku kitundu abeera wakaawe n'abeera mu mirimu gye ewaka nga guno ogumusasuza taguliiko n'ayagala gye kugumusasuza ssaawa nga 6. Ekyokubiri, abasawo bwe balwawo ku malwaliro wonna we babatadde mu ggwanga wonna, si wano wokka we tuyimiridde Semuto, naye mu ggwanga wonna bwe balwawo ennyo ne bafuna omukwano n'abatuuze abalala, kibaleetera okubeera nti n'omulimu tebakyagufaako, ng'ayimuka wano waakolera n'agenda n'akyala ewa mukwano gwe n'adda mu mboozi, naye ng'ate ku ddwaliro waliwo abalwadde.
Oluvannyuma lw'okutuula essaawa nnamba wali, omusawo n'alyoka ajja. Omusawo bwe yajja yatandika kuwera bweki ku bisaaniko eyandibadde akola ku ki. Olwo tuli ku ssaawa nga 7 abantu bandi bakufuna bujjanjabi.
The question is, what should be the solution to the problem of late coming of health workers who are living at the hospital, being given government facilities to sleep in? Others are residents from this place living within the vicinity. But the challenge is that they do not want to come to report at work on time.
Tuyambyeko abasawo ne batalwa nnyo ku malwaliro we babatadde, bwe bandiruddewo ekinene we babeerawo emyaka 2 ne bavaawo ne bagibwawo ne bakyusibwako, basobola okubeera ku mirimu gyabwe ne bagikola bulungi nga bakyusibwa bwe batyo. Naye omusawo bw'abeera awantu myaka 7, myaka 5, oyo aba takyakola.
This hospital that you are seeing here has a rich history. This is one of the hospital in the cradleland of the NRM Bush War. We are meant to understand that during the NRM Bush War between 1981 to 1986, this hospital used to act as a facility where NRM rebels would come for treatment. Not only NRM rebels, even the commanders of the NRM rebel movement used to be treated here, including their commander, that is none other than General Yoweri Museveni. But the health situation here is quite alarming. This is the general ward where you find children being treated from here, the elderly people. Even we are meant to understand that inside here it also has a dental facility where people do come for dental issues, and they are worked on. But the situation also there is quite alarming. There are very few bays. The bays are quite dilapidated. One would think, having played a very significant role in the NRM Bush War, much attention would be given to this hospital. There would be a serious facelift of this hospital. But quite shocking is that no facelift has been given to this hospital. The hospital was built way back in the 60s, but up to now, the situation is quite alarming.
But what have we gained? Are these the same types of mattresses that are in the areas of Mbarara where His Excellency and the colleagues come from? Can the President, his daughter, come and deliver from this mattress? You look at it. Can Honorable Namaya, you has been a minister? Because, of course, we blame the President, but we have had very big people in government positions.
But have you heard an interface with the President Museveni, and you put such issues to him? Because
tebatuyambye era kyekisinga okutuluma, tetuyambiddwa naye ate twekubagiza kubanga nongamba nti ate oliwaawo tugenda tugamba nti kasatu webaka ku tulo, naye oyinza okwebaka otulo ng'obulamu bwo buli mu katyabaga. Osobola otya okubeerawo? Osobola otya okubeerawo? Nkaera bunyonyodde mukama waffe beekwekanga wano era wano we baafuniranga obujjanjabi, naye kusaya kakati ate abantu badde basooka okufuna omugaati ogusooka okulowoozebwako ennyo ate polikati twetusembayo tukabukaabi.
Well, one would expect a well-organized maternity ward where mothers of this country come to give birth in a well-organized, clean place. But getting inside here in Semuto Health Center for Maternity Ward, these are some kind of shocks. When you look at this kind of bed, all the beds are torn. We are meant to understand in the recent past, before they got help from one of the political leaders of this place, these beds were littered with bed bugs. But as you can see, this kind of bed is a bed where mothers of this world give birth. But the chances are high that mothers can easily contract other diseases in such a kind of maternity ward. Taking account, we are seeing about 7 to 9 beds here, but all of them, the mattresses are torn. That means that there is need, government, of restocking these beds here. But even going away from this, when you tend to look at what would be the cupboards where mothers of this world would be keeping like drugs, but you find that these cupboards where medicine is supposed to be kept, you find their boxes, quite a very disorganized and dilapidated place. And again, when we take another stock of look, you find that that's where they're keeping some kind of folders. The whole situation inside here is quite very pathetic. It just needs some kind of special attention of the whole of government to address the alarming situation here in this maternity ward for Semuto Health Center 4.
As you've seen the situation here, it is self-explanatory. There's nothing much I can talk about it. You've seen where our mothers deliver from. The situation is too bad, but what can we do as politicians? I've just joined Parliament. I'm trying to ensure that at least we get some bit of changes, given the fact that this area should have been given a first priority, because it is where President Museveni started his guerrilla war. And this is the same hospital he used to get drugs when he was in the bushes fighting the regime of Dr. Milton Obote. But of course, I've talked much and much and much, but the kind of leadership we have had for the last 30 years, it hasn't been so much paramount to this area.
What you are seeing in the background is the mortuary at Semuto Health Center 4. That small house that you are seeing in the background, it is a house that where dead bodies are brought. But looking at it, it is already in a bushy situation. When you look at such a kind of a mortuary of a health center 4, one just get shocked. We are here trying to track to get closer to this mortuary, but it's quite unbelievable. One just treks through gardens where it is kept. The reason is not yet clear why they had to keep it this far, but we are now here. It is already locked. One cannot easily access. As you can see, the door has been eaten up by termites. Quite a very small, so alleged to be a mortuary. But now I'm being joined with a gentleman here who is a resident. Sir, kumbira mortuary yamwe.
Mortuary eno mu butuufu eri bubi nnyo nnyo nga bw'okiraba. Wadde olaba nzigale nenga oguddeko n'olaba munda bwe wali omulambo gubeera ddala wansi nga n'omuntu ne bw'aba afudde n'omuteeka mu kati kalinga kolabye waggulu kisingako kubanga olwensonga ne bw'omuteeka wano abeera bubi nnyo nnyo wano n'embwa eyitawo wansi n'esobola n'eri omuntu gwe mba mutaddeyo. N'olw'ensonga eyo tusaba gavumenti etuyambe erabirire mortuary eno egizimbe bulungi kubanga kiswaza nnyo kulaba ngeno LS Center 4 Semuto nene bagenda mortuary efaanana bweti mu butuufu lwakuba okikoze bubi nnyo n'olaba nga si waggule. It
has not been an easy story getting down to this mortuary, but most perturbing has been the story that has just been narrated to me by one of the residents called Soze. But the question that I have put to him is, how do guys work in this mortuary and medical doctors make it to this mortuary? It is quite in a very bushy situation, a very disturbing scenario here.
Emirambo waliwo ka stretcher ke baleeterako era bakaleeta nga bamuleeta nga bamuteeka muno balejja bamusitudde busituzi wano tebalina wadde ne ambulance ate nga erese center face eteekeddwa okuba nga erina ambulance eddusa omulwadde oba ekiwoko oba enakaseke oba emulago ne wano abantu babonaabona babateeka ku buboodabooda bukabangali ne beka babatwala.
We are now walking with Soze, who is my guide in all these trekking to establish what exactly goes on. But as we move with Soze, Soze is leading me to a place that is called to be the limbo, where they bury people who do not have a relative, end up dying in this very place. We have finally now reached in the limbo of the hospital, where they bury people who do not have relatives, people who come from areas that they do not know. But what you are seeing behind me, these are graves of people who are alleged to have died without relatives. And the just recent grave that we have established here is this one. It seems it is was a grave of a very young person, because you can just see flowers. But now we are being corrected that it was a grave of an old person. There are flowers there, and you cannot believe that this is a grave the way it was. Like, it must have been like a 2 feet or 1 feet kind of a grave. But we are meant to understand that all this place holds graves, and more especially where I'm standing here, I'm meant to understand that there was a grave that was in this very place, but a few days later, the person who had been buried in that grave was later stolen away from this very grave. Now, let me get back to my guide, Soze, to give me an insight of this grave. What goes on in this graveyard, the limbo, the cemetery of this hospital?
They're burying here the dead people, but there's some people that are taking it. Now I don't know how the government is going to help us, because they have to organize a good place for the bioswim, and they put there more security to guide the grave, or they build somewhere that's possible for the dead.
Nti bwe baziika omuntu wano oyinza okukeera ku makya nga bamututte, ate n'olw'ensonga nti teri mu mateeka mu makubo matuufu. Wano abamu batugamba nti waliwo alimirawo nnyiniwo, naye nga tebatugamba mbu wali paati ku ddwaliro. Kati n'olw'ensonga tetunnabategeera kituufu kyeki. Kati waliwo emabega kaundu za maybe ng'omwaka gumu, waliwo omuwala baamuttira mu kikondo ne bajja ne bamuziika awo. Kati omuwala ne bamubbawo ekiro, naye tewali n'omu yategeera ni yamutwala okukeera okebera ng'entantula bayeeguddemu, naye nga n'okulabira nga omufu baamutwala. Kati buli gwolaba gwe bateeka wano ye muntu abaabuliddwako abantu be.
Nnungi kuba oziika omuntu ate nkya n'otamusangawo, kintu si kirungi. Yandibaddewo abantu be bandirabise bafuna oba bajjawo amagumba, naye okujja nga ate taliiwo, kintu si kirungi.
Yo gavumenti esuulidde nnyo ebyobulamu, naddala mu Luweero yandibadde tufaako nnyo, kubanga twakula kyamaanyi okulabika nga gavumenti ebeeranga bweri, naye okulabika nga ate abaalwana emirambo bagimalako eddembe, gwe baziise omufu naye alina eddembe lye okubeera ng'ali mirembe bamutadde, naye mwana wattu ng'ensolo ate zimujjayo ne zimulya, kitegeeza abaalwana tulinga abaalwanira obwereere.
The biggest problem that we have established here, which is the same cry across the country, is the issue to do with the scarcity of drugs in public hospitals. We are meant to understand here from medical doctors, local leaders, the locals here, that there are no drugs, but government claims that it sends drugs. Doctor says that there are no drugs here. Now the question is, who is fooling who? Who is at the center of this ping-pong game? Let us have the views of the people who come to get medication from these very health facilities on whether there is really medicine in this hospital or not.
kyewuunyisa eddwaliro eddene lenke lyandibadde wano ne bakuwandikira eddagala ne baga nti genda olinonya mu dispensary ate nga lya gavumenti. Kale no fe kituluma nnyo, kitulumira ddala naye tetulina kyakukola okuggyako nga mutukwatiddeko.
From the butcher toilets, now we are in the kitchen for mothers who have just given birth. These are a ramshackle kitchen. This is where they are meant to come and prepare food for their newly born or for the patients. You can see, having taken just a seat here, this is the firewood and that the newly born mothers use to prepare food. Quite a very amazing situation. Poor sanitary conditions here. You can see all the dirt that involves in here, but it seems even the patients here have decided to abandon this kitchen from using it because it just turns out to be a recipe of other diseases. Like now you can see such a kind of Tyson that sucks. We don't know what is here. It seems to be quite a very pathetic situation. Either people urinate in this kind of kitchen, but that's what now the sanitary situation here holds. Timothy Sibasi, WBS Television here at Semuto Health Center in Nakaseke District.